Good afternoon. I'm Katie Reyes, and I'm the Assistant Dean of Diversity, Equity, and Inclusion in School of Medicine, as well as an anesthesiologist here. And I'm very pleased to introduce our speaker today, Gina Urias-Sandoval, who currently serves as the Chief of Staff for Dr. Ziodonis, Executive Vice President for Health Sciences, and CEO of the UNM Health System. She has previously held several key administrative roles at UNM, including at Anderson School of Management, where she served as the Executive Director of the Executive and Professional Education Center. She also recently received a prestigious award for being a woman of influence by Albuquerque Business First. She chairs the HSC Childcare Work Group, which finds out about childcare needs and addresses childcare needs, and is mainly comprised of clinicians, and a work group that I was lucky enough to be able to participate in. And I will just start us off by saying that we know that childcare is a family issue, not solely a women's issue. But the Planning Committee for Women's History Month was interested in hearing the women's perspective on childcare, and also getting a very complete and exciting update from Gina on this issue. So warm welcome to Gina. Thank you so much for being here.
Well, thank you so much, Dr. Reyes, and thank you to Ms. Swan as well for coordinating this. Good afternoon, everyone, and thank you for your interest in this topic. This is something that we have been talking about for about a year now, and I'm really excited to give you some updates. Let's talk about the agenda first. I want to give you a little bit of, just quick background on childcare, historically, how we started and where we are. I want to talk to you about some of the work that we've been doing and talking to some of our peers about how they're addressing their childcare needs at their campus. And I also want to talk about, the need for access to childcare and what the data says about that. I'll give you a historical perspective on what's happened in the past. So previous to me being in this role, some of the childcare center plans that occurred here at UNM Health Sciences and UNM Health System. And then finally, just talk about what we're currently doing, which is really exciting. Some of our plans for hopefully standing our own childcare center and possible collaborations with main campus on their children's campus as well. And I'll allow for some questions and reflections at the end. So the evolution of childcare, it's been occurring for about 100 plus years. In the mid 1880s, we knew that there was a need for women to work and have childcare available to them. Now, I'm dating myself when I say this, but I do remember growing up in Texas and having daycare centers actually called nurseries. And so some of you might remember that. Those of you who are younger will not. And that really comes from, it started as wet nurses that were in homes helping moms take care of their kids, who were literally helping them breastfeed. And I think the name just kind of stuck, and the word nursery really wasn't dropped for a really long time. So childcare centers were called nurseries. It wasn't Osuna Nursery where you go buy flowers, but it was literally a place where kids went to be cared for. The needs during the war increased. So each time we had a war, these needs increased because women were out in the workforce a lot more. And so we saw that historically over that timeline. During the Great Depression, however, it decreased because people were unemployed. And so there's been some up and down, but during the women's suffrage movement and beyond, really started to pay more attention to how do we provide childcare. Lots of things started to happen in our country in regards to setting some regulations and some accreditations and rules about how childcare should occur, both in a home setting and in daycare centers. Many of you know that Roosevelt started the first early Head Start program and provided federal funding for that. And following that administration, every single administration after that has addressed something having to do with childcare and enhancing what foundation was started. So some examples are the child tax credit. And those of you who are parents and are doing your taxes right now know that that changes from year to year, how much and how that applies. But that is something that has been specifically worked out to address some of the offset some of the costs of childcare. During the Reagan era and the welfare reform in the 1990s is when we saw the most drastic changes in both early Head Start programs, preschools, and in childcare. We started off by looking at some of our peers, and University of Texas El Paso, or UTEP, is probably one of our closest peers in proximity. They now have an agreement with the University of, so Texas Tech University, and have some health sciences on their campus as well. The unique thing that they did is that they partnered with the YWCA to provide this early learning academy. As you can tell by the rates, and I put the rates on here because it's quite affordable, and it really is based on the needs of the students. And so it's really 100% focused on students. They have drop-in rates and have a really great service contract with YWCA. The disadvantage to this is that it doesn't fully need, the person I talked to talked about how very small margin or percentage of the students, faculty, and staff's needs for childcare are addressed through this plan. But, compared to what they had before, which was literally nothing, this was a huge step from them. University of Texas El Paso also, before they started this collaboration and this service contract with the YWCA, had arranged for contracts with other childcare centers who would provide low-cost childcare to their students in particular. And also there were some divisions within UTEP that provided subsidies for their students. So they've been very creative. This seems like a really great plan, but the need is so much greater than it's being addressed here. The University of Colorado Boulder also, does a good job of addressing their needs. They actually have a children's campus, similar to how we have our UNM children's campus. It is focused on graduate and undergraduate students, faculty, staff, and alumni. But the difference here is they also accept applications from community members who are not a part of the campus community. So they will open up a certain number of their slots to people who are non-university associated or student or employees. And so it's a little bit different there. They do have a lot of scheduling options. You can see the cost here. It's closer to what you might see here at our children's campus as well. Arizona State University has done a good job as well. They've set up and opened their children's campus in 1992. They also have really unique programs. So they've done things like integrated their early childhood education programs. So some of the practicums that need to be done by early childhood educators during their learning has been integrated into what they call children's labs. And there's a certain number of slots that are available for that. So the benefit of that is this, you're able to place your child in a setting where there's actually experts teaching others on the expertises of working in early childhood. So it's a really cool plan. They have Arizona State also has this family resource center. So they provide financial assistance, they do subsidies, and lots of different stuff. So I think that of all of our peers, Arizona State University is doing a really good job in addressing their childcare needs. The Sun Devil childcare subsidies specifically for ASU student parents, and that was provided through a grant and philanthropy. So also something that we're looking at and thinking through as we talk to our peers and find out what they've accomplished. It really does give us some thoughts about what we should be doing as we're moving forward. Our UNM Children's Campus, most of you know and probably have had your children or currently have your children there. It's a magnificent place. Here is some of the rates for the children's campus. It's comparable to what you would see from the Colorado schools. And so you tend to see those regional rates, just like everything else, just like real estate and cost of living, other cost of living. The children's childcare services fall within the same kind of economic rate for the cost of living. And I'll talk more about the children's campus when I talk about our potential collaborations with them. Other universities do really unique things. When they're not able to stand up their own childcare centers, they have childcare reimbursement programs. So some schools, particularly those schools who are training healthcare professionals, so there, we all know that there's a need for nurses, for example. So a lot of nursing programs are offering childcare reimbursement programs as an incentive. So they're using it as a way to recruit students, but the health systems are also using it as a way to recruit clinicians to work within their system. So they reimburse their employees either wholly or partly for their costs for childcare. The other thing is they've been really created, other universities and health systems have been created about creating sick and backup childcare usage hours. So much like we as employees at the university gain and earn the sick leave, we would have a certain amount of sick and backup childcare usage hours. When we talk about the need for childcare and the focus of, who is it that is most impacted by childcare? And, Dr. Reyes mentioned this is not an issue that is unique to women. We want to be inclusive and mention that, this impacts fathers as well. And I'll show some of the data in just a little while, but I think when we talk about sign up, backup childcare usage hours, even those of us who may not have had children and have had the struggle or the challenge of balancing life and work and having to deal with having kids in childcare and how you manage that while you're trying to pursue a career or finish your education. Those of us who don't have children are impacted by the fact that we work with people who have those struggles, and it may impact our work indirectly in that way. So I think that a sick and backup childcare usage hours is really useful because it gives that employee the opportunity to be out when they need to cover for their childcare. There's also been lots of universities that have had childcare service agreements with local centers. So similar to the Y at UTEB, they have an agreement, a service agreement. They'll agree upon a sliding scale that would benefit the students and faculty and staff of the university. So I think that's really great. And also I've mentioned before the use of current early childhood development training programs as a way to provide childcare. So you're doing the training at the same time that you're providing the childcare. Here's what we know about access to childcare. We know that the pandemic has really exacerbated a lot of the care crisis in the United States in terms of childcare. And that we know that it's been, this has placed a disproportionate burden on our families and our mothers in particular. Young women, for example, according to the data, were more likely than their male counterparts to identify care responsibilities. It's the main reason for not working for pay during the pandemic. And some other evidence talks about the balancing the demands of college work and family, securing affordable and reliable childcare is important for any parent who's enrolled in college or any parent who is hoping to complete their education. So what we saw a lot during the pandemic is families, mothers in particular, dropping out of school because they didn't have that access to childcare because the COVID pandemic really brought on a lot of unexpected issues in that arena. And they sacrificed by dropping out of school so that they could stay home and take care of their kids. So it's amplified the problem, I think, compared with our peers when we're talking about, caregiving demands. Parents are more likely to pause. And, this decision was made, on putting their families first. In our unique circumstance at UNM, we have a population that is pretty unique when you think about the structure for childcare. So the UNM Children's Campus, again, a great place, safe, secure, well-regarded, and highly rated childcare center. The structure by which it decides its prioritization in terms of, students are priority, staff and faculty come next. And so students have available more slots to them. They also pay the lowest amount for the daycare, which makes sense. Our medical residents kind of fall between the cracks on that, right? Because they're not really students enrolled in college at the time that they're residents, so they don't have bursars accounts where they're paying for a class. They also may not be a UNM employee, so they don't fall completely under that, and maybe be hired more under the clinical setting. But because they don't fall under the categorization of a student, they're not considered a student in that system, and so they do kind of fall below the cracks there. We know that a child care center on site may contribute to us having a greater interest in residents who, for example, want to come in for a certain specialty, and it might appeal to them that we would have childcare available to them, because I think that's an important piece. So again, really important for recruitment of medical residents. In a national survey of medical students, and female students reported that they were more likely to be interested in surgical care if childcare were available to them through their hospital, so either as a resident or as attending physician. And in a study conducted at Stanford, women ranked a flexible work environment with regard to child care or elder care, including access to emergency care. So we're talking about, drop-ins. So when you're called in, you're a resident and you're called in to come into work, if there was childcare available near or on site, it was one of the highest priorities for them, in terms of their need to improve their career success and well-being as a faculty member. And similarly, in a survey of male and female in general surgery residency graduates, 79% recommended that employers provide childcare facilities at work. So the data is pretty clear for this group of people that if we want to recruit and retain and recruit medical residents, particularly in the specialties that are particularly challenging, we need to think about how we address the childcare needs of this population. In the Vanderbilt study on hospital employees across the board, just talked about, we really think that a childcare center on site or near site would lead to an improved workplace satisfaction. So staff morale was a really big piece of this study. This allows trainees to have more frequent contact with their children. It reduces stress and anxiety over the scheduling, and potentially providing a financial benefit to the hospital because they would have people who are more able to work through their shifts and be available to work. So an on-site childcare center would ease that transition from returning parental leave to returning to work. And so it really, if the facility is planned out in the way that we think it could be for hospital employees, we would encourage breastfeeding and pumping. We would provide a space for that and think through that as well in our childcare offerings. Emergency childcare, which is one of the needs that was identified by our population here at UNM Health Sciences and UNM Health, was the likelihood of having drop-in and emergency care so that it could reduce the number of work days missed. And again, decrease the burden on the coverage on the non-parent colleagues, right? Because the non-parent colleagues are also negatively impacted by this, although they don't have kids themselves and may not be, experiencing the same challenge. They do feel that from their peers. An on-site childcare center, I've already talked about. It's just going to be a super powerful tool for recruitment and retention, I think, of all of our clinicians and clinical programs across the board. So let's talk about UNM and what we've done, particularly UNM Health Sciences and UNM Health. So previous to me coming into this role, I've been in this role about a year and a half now. But in 2019, a group of people from UNM H and HSC participated in putting a proposal together for a proposed expansion of the UNM Children's Campus to meet the childcare needs of our UNM health system learners, faculty, and staff. It was a group of about 4 people, I think. They did a great job of collecting data, doing surveys, and putting a proposal together for that expanded footprint of our current UNM Children's Campus. They proposed that at phase one, we would maximize the existing capacity and operating hours, so that would increase the support for UNMH and HSC employees that had immediate childcare needs. What this meant was UNM Health Sciences would contribute to expanding that footprint, therefore creating slots that would be made available to UNM Health and UNM Health Sciences employees and clinicians. It would also have to agree to expand the hours. We knew from the data that was collected back in 2019 by this group, they knew that the data showed that after hour care, so after 5 p.m., and weekend care was important. So that was part of phase one thinking through. In phase two, really looking to expand both their operating hours and the days, but making it a 24-hour per day service. In phase three, they wanted to provide that capital expansion with modifications for also caring for mildly ill kids. So when your kids are, just slightly ill, that they would still be accepted into the center and be provided some care. Here's what the data showed. So there was a lot of different information that was gathered during that time. And remember, this was, pre-COVID. So when this was done again, closer to during the time of the pandemic, the numbers were a little bit different, but the immediate needs were the same. The need for care after 5 p.m. We have clinicians that work in the hospital 24/7, any type of hour, right? And so it's middle of the night, early mornings. So night and even overnight care were identified. Weekend care, because weekends the hospital doesn't close. We continue to have patients, and we need the frontline workers to have that weekend care available. The care for the mildly sick children, again, high demand. You're a surgeon, you have to leave your kids somewhere. If they're mildly sick, can we accommodate that in some way? Drop-in options, which really accommodates those who have, on-call schedules. And then what came out new, I think, at the end was after-school care. So many of our staff, faculty, student learners, and clinicians identified that it was care they needed after school, and not the previous survey had showed maybe a younger age range, and now it was moving into including the after school, the school age kids. HSC students or learners with clinical rotations, grad students and clinical staff were less likely to feel confident in their ability to manage and care for their children. So in the second phase of this survey, during COVID, they just didn't feel confident that they could manage both their career, their children's remote learning, and care during that time. Over 65% of the parents lacked the confidence of their ability to balance their work responsibility and their children's education. We focus on the aftercare here, so that we could assess how many of our community was in need of that after school and care. Cost was important, but overall in both of the surveys, both the one previous and the one during COVID, the questions that we asked regarding the age of the students and what was most of the children and what was most important. And then when we went back and assessed the after school age students, cost was an important factor. We want to make sure that whatever it is that we offer, it's affordable, but it also was not as important as quality of care and the availability of childcare after hours and weekends. All right, so here are some of our current efforts. A childcare work group was created February 28th of 2022. This is approximately 6 months after I was hired into this role. It was handed to me as an initiative. Dr. Zadonis thought that this was an important initiative, that it was something that we needed to address. And my first stab at this was really looking back at what had been done before. Why did it get tabled? Why had we not moved forward? And what could we do to continue the conversation? We knew that we needed to have some kind of work group so that we could get others' input. and particularly interested in getting input from the people who are actually working and studying here and could give us that perspective. So there was a call out for volunteers to serve on the committee. Committee meetings have occurred as needed. We started to meet regularly and there wasn't always something going on. And so we've scheduled committee meetings as needed, but we provide monthly updates via email on the status of what is happening with our plans. Here is the HSC Childcare Work Group as it stands. We're pretty flexible. We keep minutes. As you can see, most of the people on our committee have very demanding jobs and they have a lot to balance. And so we don't always expect that everyone will be at every meeting, but that we could capture the majority of folks at a given meeting and move through some of our agenda items. There we go. Here's some of the things that we've done as a committee or task force. We've talked about what the needs are of our learners, students, staff, and faculty and clinicians, particularly what the current needs are of our frontline workers. So that's really important. We've explored some interim care options also, so referral services. We reached out to a company called We Care. They submitted a proposal to us. This committee reviewed the proposal and we followed up with them. At the end of the day, the price point for the referral program did not seem to be something that the committee thought was well worth the investment. And at that time, we were also talking about pulling funds together to do inspections on a possible donation of a building for childcare. So we kind of weighed that with the cost of this proposal and decided to table the referral program. We did collect data on local services. We also collected data on, big thanks to Jody Perry, if you're watching today, on picking up, and looking up stuff on what our state's childcare regulations are, the types of accreditations and what they mean, and what we might be striving for if we were to start our own childcare center here on campus. Around that time, we found out that there was a possibility of a donation of a building. So at 1613 University, there is a building that was previously the Campfire New Mexico building. Campfire International and National decided to sunset its program here. And one of our financial employees from the financial group sat on the board and recommended that they donate that building to us. So the donation of that building has gone through several phases. It had to be inspected. There was costs involved with that. So, about that time when we're thinking about the referral proposal and the cost of inspections, we thought, okay, let's get this building inspected and find out if it's a viable option for us for childcare. There's expenses having to do with architects looking at the building and deciding whether or not we could remodel it to meet our purposes. The childcare group, the workforce group, knew that we had to start working on a request for proposals for the service. So if we had the building, then we would have to do a request for proposals to find someone to do the service, the actual childcare service. At that time, people started to also approach us on the possibility of joint venture options, which we're still currently meeting with folks and talking about the possibility of a joint venture. So a joint venture would mean that there is a company that does childcare. Maybe they have 3 or 4 childcare centers, and they're wanting to invest in our childcare centers. So they would pay for the renovations, bring in the equipment in exchange for us agreeing to have them be the service provider for a certain amount of time. So I think that's a pretty entailed process. There's a lot of legalities, but that's also something that has come up and we've had several meetings on. The capital project planning and just looking at the footprint and, of that building and what that would look like has taken a little bit of time as well. And we've been working closely with our facilities and capital projects people to get good plans and good estimates for what it would cost for a renovation. And meanwhile, we're drafting the RFP for the service. Most recently, we circled back with conversations with main campus through the Office of Student Affairs on the previous plan. Funding is an issue on this collaboration, but the Vice President for Student Affairs at UNM is really interested in this and is hoping that we'll be able to find a way to collaborate. It's not for us an either or, I don't think. I think that the need is so great if we're able to find a way to collaborate with the children's campus for an expansion of the footprint and figure out a way to upstand our own childcare center, we would do both. So the process for the land donation for that campfire building has taken an entire year, literally one entire year. We worked with the real estate office here at UNM, capital projects and facilities. We did inspections. And so we're at that 1 year mark where the paperwork is actually at the title company and that building will be ours in a matter of weeks. And so we'll move forward with thinking through, will we do a joint venture? Will we invest in this on our own? And or the also expansion of the children's campus. And finally, I wanted to say that you're probably aware that we've been doing strategic planning. I'm acutely aware that we've been doing strategic planning. And what's really come out of our strategic plan over and over again is this topic, the need to address childcare. And it's come out in the different work groups having to do with research and clinical work and student engagement. It's come out of almost every single priority work group in our strategic plan. So it's consistently being brought up as a priority for us in our strategic planning to move forward. And we really, really hope that we can bring this together and provide the childcare that, address some of the childcare needs of our learners, our students, our staff, our faculty, and clinicians. Thank you so much. We're so grateful for our workforce. I think this is why we're really pushing hard to have this happen. We know it's important. We also know it's important for recruiting the best workforce and students and learners, and to continue to thrive in that way. So we're so grateful to you, and I'm so grateful that you were here today to listen to me talk a little bit about this. And now I'm going to open it up for questions. On this slide, I also have some resources for you, which also includes our UNM Children's Campus. So Amherst, I think if you want to open it up for questions, we'll address them.
Yes, everyone, if you could just put your questions in the Q&A section, that would be great. Thank you.
I just wanted to say thank you very much for that complete history and description of the activities of the childcare workforce. And if you all in the audience have any questions that you'd like to type into the Q&A or any just comments, if there's anything you'd like to share, please go ahead and do that and I can read them out to Gina. I know in speaking with Gina before this presentation, I learned a little bit more about, the extensive process that has to happen, like RFAs. I didn't understand any of that before, just being a clinician. And I just also wanted to thank you, Gina, for the incredible amount of effort that you've put towards this initiative. It's really important work that you're doing. Thank you.
Absolutely. Sorry, on the next slide is my contact information. So any of you have any questions, if you would like to join our group and continuing the conversations and plans for addressing our childcare needs, please reach out to me. Here's my phone number and my cell, so that if you have any thoughts and feedback for me, please feel free to reach out.
Okay, just last opportunity for any comments or questions in the Q&A. And I'm happy to end a little bit early. You were just really efficient with delivering all that information. So I really enjoyed the data on what other institutions are doing as well, and some of the studies that have been done around this topic and how important it is for recruitment and retention. So